Urinary incontinence, in simple terms, means you lose control of your bladder and accidentally pee, either during the day or at night. In this video, we'll talk about different treatment options available to manage and prevent bladder issues. From behavioral changes to medications and medical devices, there are lots of options available. So let's break it down. Behavioral changes are usually the first treatment, like moderating drinking, no more 4 to 6 ounces of fluid per hour. Reduce bladder irritants, like alcohol and caffeine. Cut off fluids 2 to 3 hours before bedtime. Change timing of medications. Bladder training with scheduled urination times can avoid urgency and help increase the time between urination. Some people are referred to a physical therapist who specializes in pelvic floor dysfunction. Both men and women can use pelvic floor exercises or Kegel exercises to strengthen their pelvic floor muscles, which may help control the flow of urine from the urethra. Electromagnetic and magnetic stimulation is a technology that can also be used for stimulating the pelvic floor muscles. In this therapy, you sit on the simulator to stimulate and strengthen pelvic floor muscles. Medications are usually the next step if behavioral changes in pelvic floor physiotherapy doesn't help. Depending on your specific bladder issue, different drugs can be prescribed. For an overactive bladder or storage issues, anticholinergic medications are most commonly prescribed. They work to block the signal to the brain that is causing the increase in bladder muscle contraction. Like all drugs, there can be side effects. So it's important to discuss the risks and benefits of the medication with your healthcare team. Also, for storage issues, Botox can be injected into the bladder muscles to keep the bladder from contracting too often. Over time, this treatment wears off and it may need to be repeated after about 6 months to 1 year. Electrical stimulation or neuromodulation is another way to treat bladder muscle instability in overactive bladders. Here, an electric current is used to stimulate the nerves that supply the pelvic floor muscles, causing them to contract. There are several different types. Percutaneous tibial nerve stimulation, or PTNS, is an alternative option that is done by inserting a very small electrode through the skin of the lower leg. The electrode is connected to an electrical stimulator outside your body. The stimulator sends pulses to the electrode, which stimulates the tibial nerve in your leg. That electrical current then affects the nerve in your lower back that controls bladder and pelvic floor function. Sacral neuromodulation, or SNM, is another option where an electrical stimulator is placed under your skin and above your buttocks. When exploring which treatment options may be best for you, there are many solutions you can consider to help manage ongoing symptoms. Liners, pads, briefs, disposable underwear, and reusable underwear all have an absorbent component and can protect clothing from potential leaks. Catheters are another option that help with bladder emptying. External and internal options are available and are designed specifically for males and females. Female external catheters are designed to help manage overactive bladders or bladder leakage, not urinary retention. The device is placed outside of the body and is made of soft, flexible fabric, which captures urine and uses gentle suction to collect into a canister. Males have the option of condom catheters or external male catheters. A condom catheter is a self-adhering urine collection device which encases the tip of the penis and connects directly to a drainage bag or leg bag. Other male external catheters may adhere around the base of the penis and utilizes continuous suction to wick urine into a designated collection canister. An intermittent catheter is a thin, flexible internal catheter, which is inserted by the user several times a day to empty the bladder. This option is designed to help people with urinary retention empty their bladder. Long-term or continuous catheterization, called a Foley catheter, is a thin, flexible internal catheter that stays inserted to drain urine at all times, because you are unable to do so. A Foley catheter is connected to a urinary drainage bag or leg bag, which collects the urine. You may also be referred to a urologist to explore additional treatment options, and in some cases, surgery, if appropriate for your bladder condition. Bladder problems are very common. Talk to your healthcare team about what treatment and management options might work best for you.